Okay, so
We're going to be diving into something today that maybe you think you know all about.
smoking and oral health.
Right.
But trust me.
We're going way beyond smoking stains your teeth today. We're
Yeah.
talking about this stuff.
That even people who think they're in the know might not realize when it comes to smoking in their mouth.
Yeah.
Um, I'm joined by,
As always,
but you guessed it,
an expert
Julie.
to help us decode all of this.
I'm happy to be here.
Thank you, as always, for joining me.
Absolutely.
I think there's so much
Interesting stuff to unpack here.
Yeah. It is interesting because I think people
Kind of take for granted
what they know about smoking and oral health.
because, you know, we've all seen the pictures, the warnings, everything.
Exactly.
But there's a lot more to it.
Than meets the eye.
So before we even get into like the nitty gritty,
I just have to ask you about this phrase.
smoker's melanosis.
Because I'll be honest.
I had to look that one up
What?
when I saw it in the article.
Yeah, it's not a...
Common term
What is that?
for those of us
Who are not in the know.
It sounds a little intimidating.
Smoker's melanosis.
Yeah.
But basically what it refers to is...
A darkening of the gums,
Okay.
lips.
Even the roof of the mouth. That happens specifically because of smoking.
So we're talking actual color changes just from smoking.
Color changes.
Yes.
That's kind of wild to me.
It is.
And it's not just a cosmetic thing.
You know?
I think a lot of people
think, oh, you know,
my gums are a little darker.
whatever.
Right.
But healthy gums should have that really vibrant pink color,
And any changes to that,
whether it's redness.
swelling.
Those are usually your body's way of saying, hey, something's up.
Oh,
We might have some gum disease.
brewing here.
Interesting.
But with smoker's melanosis,
Those early warning signs,
it'd be harder to spot
because the gums might not display that redness.
as readily, even if they are inflamed.
So it's almost like...
The smoking is creating a disguise.
Exactly. It's like
Block
make
it.
it harder to even see.
It's masking those.
Yeah, those early warning signs.
What's going on?
Exactly.
Wow.
And you know how sometimes...
The gums might bleed a little.
Well, when you brush your teeth.
Right.
No.
Smoking can actually reduce blood flow to your gums
And while that might sound like a good thing,
on the surface.
because you think, oh, they're not bleeding,
Right. Less blood, less of a problem.
it can actually make it harder to notice,
That bleeding.
which is a key indicator of gum disease.
So not only is it like,
Hiding it visually,
right,
it's like messing with your body's...
your alarm system.
It's like hitting the snooze button
Yeah.
on your
body's alarm system.
Yeah.
And that's where it can get.
Dangerous, I imagine.
Exactly.
Because you might not realize there's a problem.
Until it's really too late.
Right.
And more difficult to treat.
Wow.
Okay.
So we've got this smoker's melanosis
Which is like a red flag, but it's hard to see.
because of the effects of smoking.
Right.
And then we've got,
But the fact that it reduces blood flow.
which again, sounds counterintuitive, but can actually
allow problems to get worse.
mask the problem.
And then on top of that,
We were talking about bacteria.
in the mouth.
Yeah.
The article talks about how
Smoking
the amount of bacteria in your mouth
increases the amount.
and the types of bacteria,
So it's a...
creating this perfect storm in your mouth,
Exactly.
which is kind of,
Scary
it can be.
when you think about it.
So we've uncovered some pretty interesting stuff, I think.
About the ways that smoking impacts your mouth.
Right.
But now I think we're at the point where it's like,
Okay, what do we do about it
yeah, like what can you actually do?
to reverse this damage?
Well, the good news is,
It's never too late
okay,
to start taking control of your oral health.
so it's not like you...
Hit a point of no return.
No, not at all.
Okay.
Your body is remarkably resilient
And so even if you've been a smoker,
for a long time
there are steps you can take.
to improve the situation.
Okay, good.
So what are some of those steps? Is
Well,
it just quitting smoking, or are there...
Other things.
So quitting smoking is...
Obviously the ideal scenario.
Right.
But
Yeah.
even cutting back can make a difference.
Okay.
And then on top of that,
There are,
just simple things you can do
in your daily routine...
that can help counteract the negative effects.
Give me an example.
So you know how like mouthwash,
It freshens your breath.
yeah,
Well, there's a special kind of mouthwash.
that is specifically
Targeted?
at the harmful bacteria
Okay.
that thrives in a smoker's mouth.
So it's not just like...
Your average Listerine,
Exactly.
it's called antimicrobial mouthwash. And you want to look for that.
Specifically.
Interesting.
And again, it goes back to that idea that...
Smoking increases the bacteria
Right.
in your mouth.
So this helps create an environment that's just
Less hospitable,
troublemakers.
antimicrobial mouthwash.
Yes,
Okay.
that's one thing.
What else?
The article also talks about
being really consistent and thorough,
with your oral hygiene routine.
which I'm assuming just means like
Brushing and flossing, or is there more to it?
it means brushing and flossing.
Okay.
But it also, and this might surprise you,
It also means tongue scraping.
tongue scraping.
I feel like
That's something that people don't
it's often overlooked.
really
I don't think I've ever...
successfully.
Have you ever scraped your tongue? I've tried, and it's been like...
A very like half-hearted attempt
Yeah. A lot of people have that reaction.
because it can feel a little strange,
Yeah.
but it's really important
Yeah.
because your tongue.
Think of it this way. It's like a plush carpet for bacteria.
Oh, ew.
Ew.
And smoking just rolls out the red carpet.
So we want to...
Get rid of that carpet.
Yes. So tongue scraping.
Helps to remove that buildup,
And that not only helps fight bad breath,
but can also help prevent gum disease.
so it's really important for everybody.
It is for everybody.
And especially smokers.
Okay.
Tongue scraping.
Tongue scraping.
Antimicrobial mouthwash.
Yes.
Anything else.
So you know how we talk about plaque?
That sticky film that builds up on your teeth.
Yeah.
Everybody gets plaque.
Like smoking supercharges plaque.
Ooh, okay.
It makes it way stickier.
Way harder to remove with just brushing.
Oh.
And that's where flossing comes in.
Okay.
So flossing becomes even more important
When you're a smoker.
because it's like next level plaque
Next level plaque.
you're dealing with.
Exactly.
Okay, wow.
So-
this is good advice.
I'm really glad we're talking about this.
But even if you...
Take all these steps
Is it really possible
to
the damage that's been done?
That's where it's important to be realistic.
You know, the extent
Of the damage and your body's ability to heal.
varies from person to person.
Okay.
It depends on how long you've been smoking,
How much you smoked.
your overall health.
So there's really no...
Like one size fits all
Exactly.
answer to that.
The good news is
Even if you can't
completely undo the damage. You can significantly...
improve your oral health,
Okay.
you know, quitting smoking,
or even reducing.
combined with a good oral hygiene routine,
And regular visits to your dentist.
can make a world of difference.
Speaking of dentists,
I feel like
that's another thing that maybe...
people don't think about.
Right.
Or they're like,
I'll go when I have a problem.
but how important?
Are those regular visits?
They're extremely important.
Especially...
For smokers
Okay.
to
You
so
find
they're-
a dentist
who you trust,
who can work with you, help you figure out, like...
what the best plan is for your specific situation.
Because everyone is different.
Exactly.
That's what we were saying.
So you want to be able to talk to a professional
Absolutely.
who can really assess
Your situation.
and give you
The best advice...
because the dentist
That's
can-
that thing.
that you might not even notice, like early signs of gum disease,
Right.
or even oral cancer.
Right. Which is
Very important.
a big one
Yeah.
for smokers.
Yes,
I feel like we really went deep today
we did.
on something.
That maybe people think is like old news, right? Like we've heard it all.
Yeah.
But this is,
Really fascinating stuff.
it is fascinating.
Wow.
And it's something that
That
don't
looks really
realize how
fine.
it all works.
It's not just like...
A PSA.
Right.
Right?
It's really understanding the why
Yeah,
exactly behind it all.
So
Before we wrap up, I kind of just want to like
recap some of those
major takeaways
Sure.
for our listeners.
Okay, so we started by talking about
Smokers' melanosis.
right,
That darkening of the gums that we see in smokers.
and how it's not just a cosmetic thing.
It's not just cosmetic.
Yeah,
It's a sign of damage.
it really is.
And it can actually...
mask other symptoms.
Right. It's like we were saying, it's like,
Your mouth's warning system
Exactly.
is kind of being put on silent.
yeah, it really is.
And then we talked about how smoking,
Reduces blood flow
yes,
to the gums.
which again
Sounds good on paper, but really isn't.
sounds counterintuitive,
Yeah,
but can actually make things worse.
because you don't see those warning signs.
Exactly. And then, of
You
course,
can't forget about
Bacteria.
bacteria.
Right.
Smoking equals...
Black Harry Party.
Exactly. It creates an environment
Your bacteria just thrives.
in your mouth. It's
Huh.
not a good situation,
Not at all.
but we did talk about some
Sounds that you can do.
to combat this.
Right. We talked about
Antimicrobial mouthwash,
Yes.
the importance of flossing,
Yes.
tongue scraping.
Tongue scraping. Even though it sounds weird,
I know.
it's so important,
It's
especially for
the
smokers.
thing that I'm like,
All right. I got to actually.
try this.
You got to try it.
So as we...
So we'll wrap up here.
I guess my final question to our listeners is
What's one small change
that you can make
today?
to improve your oral health.
I love that.
Right.
Whether it is
Cutting back on smoking.
patting tongue scraping,
No.
into your routine.
Brushing more regularly.
Brushing more
That's
regularly.
here it is.
Flossing. There are little things you can do.
Yes. And I think
Don't underestimate.
the power of those small changes.
Right.
Because they really do add up.
They absolutely do.
And I think that's a good...
Place to leave it.
I agree.
For today. Thank you so much for
reading here.
Thank you for having me.
I feel like this has been
A really
eye-opening.
It has been. I hope our listeners.
I hope so too.
Thanks again for joining us for this deep dive.
We'll see you next time.
See you next time.